Hi everyone, welcome to Unity Massage Myotherapy. I'm Anne-Marie. This video is about pelvic floor exercises and the equipment needed is Franklin balls or something similar such as a soft massage ball, nothing too hard, a tennis ball or something larger again, it will be okay too. Now this exercise helps release tension in the hip joints and our lower back. If the pelvic floor is tight, it can be from incontinence, childbirth, or surgery in the pelvic region. Now this pillow represents the pelvis, and in the front we have our pubic bone, and at the back we have our tailbone, also known as the coccyx bone. We have our hips here on the side, and underneath we have our sit bones, or our ischial tuberosity if you want to be precise. Now, when you have tightness in the pelvic floor, it can become hard to sit onto these sit bones or our ischial tuberosity. What happens is, using the pillow as the demonstration, this becomes short and it becomes hard to sit onto these sit bones and causing tightness in our lower back and our hip region. And it may stop you from bending forward to touch your toes, for example. Now, to help with this tightness you may be feeling, you'll be using the ball to help lengthen into this area. You'll be placing the ball in between the hip tailbone and you'll be rolling onto the sit bone. First thing before we get onto the ball, just check to see our flexibility just in this position. Are you even able to touch your toes? So if I want to try to touch them, that's as far as I can go. Where am I feeling that? At this stage, I'm having issues in this region here because my pelvis is not able to open up. So that's me for now. So the purpose is that we stick the ball in between the pelvis, or the hip, sorry, and the coccyx bone. So we're actually on the bone, the sit bone, and that's what we want to go on and back down. Going onto the ball and back down, onto the ball and back down. Use the arms, gliding onto the, rolling onto the ball, using onto this leg and back down. So that sit bone, that's where the ball needs to be underneath as we roll onto the ball and back down. Rolling onto the ball and back down. If this is easy, you take the hands away and now we're actually firing up the obliques and back down. What you're doing here is you're really activating the core to help roll yourself onto the ball and back down. And you can do this for about a minute or two and back down. And you can start to feel that area where that sit bone is. Like, yeah, I've always wanted to get into that area. This is a great way of massaging into that. This starts to help lengthening that those ligaments and muscles in between the coccyx bone to the hip. And now what we do is take the ball away. Oh, what's happened to me right now? I have felt that my leg has dropped into the ground more. If I notice that back space now, I feel that fan, it's like a fan feeling, it's opening up. So going back to this pillow as a demonstration, as that was all shortening in the back here, this area has started to fan itself open. So let's do the other side. Getting onto the ball, so onto that sit bone underneath, rolling onto the ball, back down, rolling onto the ball and back down. Too hard, use your arms, whatever level you're at, absolutely fine. If you find that it's too hard even having your leg fully extended. Bend the knee, that's absolutely fine, rolling down. Everybody is different, and this is designed to help get that more lengthening into that pelvic region. But the aim is to then, no hands, rolling onto the ball and back down. Rolling onto the ball and back down. Do this a couple more times. See how it feels. Sometimes you go, oh yeah, that's exactly where I want to get into. And back down and up and back down. This is great for SIJ issues, sacroiliac joint, and back down, because we're getting right underneath that area of the sacrum. And back down. Come away. Notice how you feel. Oh, I've got that lovely fan in the back. Let's see how I can now touch the toes. Now, that's at full stretch, and I can, if I want to, go further, because I can feel in the back there now. It's like, oh, I can get there. For the next part, what we're going to do is from the pubic bone to the coccyx bone. So the ball, we're going to go from one end to the other and back. So we're going to sit on the ball, we're going to bend the knees, we're going to come onto the ball and use your arms. So legs come out, and we're going to roll on. So now I'm almost to the end of where the coccyx bone is, and then we roll forward to the pubic bone. Do this really slowly. You don't need to put all your weight on it. Just take your time. For some people, it can be, you might have that reaction, and we are actually doing the sling of the pelvic floor muscle. And just do it gently and slowly. You will feel in certain areas where you go, oh yes, that's always a place that I can feel that I cannot get into. This is a great way of how to massage into this area. Slowly, controlled, using your arms, that's the weight that we need. If you want more pressure, you then release the pressure off the arms and coming all the way onto the ball. Coming back off. Notice how you feel. Again, let's see how, are you able to go even further? Yes, that's not even at full stretch. Go full stretch, I can get to here. Now what we're going to do is putting the ball underneath the coccyx bone or the tailbone. So in order to do this, again, we're just going to bend the knees and don't just come straight onto the coccyx bone, just maybe come off at first and then just slowly roll onto it. Once we're on it, I'm still on my arms. I haven't quite got to the bone itself. Just gently come onto the bone, onto the tailbone, and just hold. Take a breath, because it can be very tender for many people. Come back off, come up, and then slowly sink down onto the tailbone. Now what I'll get you to do is come back up and down. If this might be enough for you, that's fine. If you want a little bit more, just little movements. We're just rolling forward and back on the tailbone. Just very small movements, forward and back. Think of like maybe a millimetre. That's the kind of movements we're doing on the tailbone, forward and back. Then we can go side to side. Just micro little movements. And then we can go diagonally in one direction and then diagonally in the other direction. And then just feel, where is it easier? Is it easier going backwards and forwards, or side to side? Or is it easier going diagonally in both directions? And then just keep working at all those directions. come back off, rolling forward off the ball, placing the ball there, and notice how you feel. Are you able to get further forward? Yep. If I go into a fuller stretch, definitely. My whole lower back, that region that I was talking about, that fan has now opened up. Especially when you've had any particular trauma in this area, those areas start to shorten, and now able to lengthen, which means I can lengthen forward because now my hamstrings are finally being added into the stretch, and I can also feel my lower back as well when I go into the stretch. Yes, enjoy this exercise, and takes roughly about 5 to 10 minutes. You can do them daily, and yeah, just to help in that pelvic region. So stay tuned for more exercises of the body. I'm Anne Marie from Unity Massage Biotherapy. Thank you.